Hello there, you're welcome to the teacher channel and welcome to this video. And this video will be on BLS practice quiz number 2, and it is with a voice note. If you prefer to not hear the presenter's voice, there is another version that is a quiet mode. You can listen to that. Okay. So what is the objective? So with this quiz, you can assess your knowledge of the basic life support, prepare yourself for a basic life support training, determine how much you know or how much you need to know in basic life support. You can also use it to build your confidence in basic life support. And there are 2 leading questions, 2 guiding questions that we are going to use. How much do you know? How much do you need to know? Very, very important questions. And you are going to answer this question by the time you go through the questions. So please attempt all the questions. Answers will be provided at the end. You can give thumbs up. You can put comment on the comment box. You can share it widely to your colleagues and other people. Subscribing, if you have not done so, is a very good idea. You can also turn on your notification bell, and I will appreciate that. Thank you so much. And you will be presented with a few multiple choice questions, and only one option is correct. So for each question, you need to pick one option that you think is correct. Later, at the end of the presentation, we're going to present the answers, and then you can match your answers with ours and see how good you have performed. So take a piece of paper, take your pen, get ready to write your answers down. And this should be fun. You should enjoy it. Okay? No hassle. Enjoy it. Sit back. Assess your knowledge in BLS. Question number 1. You noticed someone laying in a supine position on your way to work. You shouted, "Are you okay?" and gently tapped both of his shoulders. The person did not respond. What will be your next action? What will be your next actions? A. Yell for help and start CPR immediately. B. Yell for help, assess for normal breathing, and pause and wait for help to arrive. C. Yell for help, assess for normal breathing, and pause, then call 911 and start CPR if breathing and pause are absent. D. Use AED since it improves chance of survival. What is your answer? Question 2 is here. CPR is a resuscitation attempt which could be expressed as 32 times N. What does this expression mean? 32 times N. What does it mean? A. Perform 30 chest compressions followed by 2 breaths about 5 times. B. Perform 30 chest compressions followed by 2 breaths until at least one stopping condition happens. C. Perform 30 chest compressions followed by 2 breaths about N minutes. D. N team members perform 30 chest compressions followed by 2 breaths. N team members perform 30 chest compressions followed by 2 breaths. Question 3. Which of the following victims should receive CPR. CPR is an emergency care. Which of the following victims should receive CPR care? A. An unconscious victim who just fainted. B. A cardiac arrest victim who has agonal breath. C. A heart attack victim who is having shortness of breath. D. All the above. E. A and B are correct. Question 4. AED is highly recommended during a resuscitation or CPR attempt. Why? Why is AED highly recommended? A. It prevents future cardiac arrest. B. It helps blood flow quicker to the vital organs. C. It significantly improves the victim's chance of survival. D. Or the above. Question 5. AED is a lightweight and portable device that is easy to operate. It can deliver electrical shocks, which is capable of A. Eliminating abnormal heart rhythms. B. Restoring normal heart rhythms. C. Doubling or tripling the victim's chance of survival. D or the above. What is the correct option there? And then we go to question 6. Question 6. There are some special considerations with the placements of the AED pads. Which of these are among the special considerations? A pad should not be placed directly over an implant like a pacemaker. B. A hairy chest may need to be shaved or waxed. C. AED should not be used on a victim who is 9 months pregnant. D. All the above. E. A and B are correct. Question 7. After placing the pads, an AED detects shockable rhythms and recommends a shock. What should you do next? A. Press the shock button immediately. B. Make sure no person is touching the victim, then press the shock button. C. Start a high quality CPR. D. All the above. Question 8. Which of these statements are correct about giving breath during CPR? Which of these statements are correct about giving breath during CPR? A. 2 breaths should be given over 5 to 10 seconds. B. 2 breaths should be given over 2 seconds. C. Seeing visible chest rise indicates that the breaths are delivered effectively. D. All the above. E. Only B and C are correct. Question 9. A colleague is about to start CPR on a 7-month-old victim. How deep should the compression be? A. Approximately 5 centimeters, about 2 inches. B. As deep as possible. C. At least 1/3 the depth of the chest, approximately 4 centimeters, which is 1.5 inches. D. Only B and C are correct. Question 10. CPR could be expressed thus: C colon B times N, where C is the number of compressions, B is the number of breaths, while N is the number of cycles. What would be the values of C and B if 2 providers are performing CPR on a 3-year-old boy? A, 30 and 2. B, 15 and 2. C, 30 and 5. D, 15 and 1. Question 11. Allowing the victim chest to recoil full is one of the attributes of a high-quality CPR. Why is this necessary? A, so that blood is carried away from the heart. B, so that blood can return to the heart. C, to ensure that compressions are deep enough. D, only B and C are correct. What is your choice as we go to next question 12? What should be done differently when performing CPR on an unconscious choking victim? What should be done differently when performing CPR on an unconscious choking victim? A, no breath is necessary since the airway is completely blocked. B, check the mouth first before giving breath. C, giving breath forcefully will help remove the obstructing object. D, alternate CPR with abdominal or chest thrusts. Question 13. Bob and Ray were having burger for a lunch when Bob starts coughing loudly. His eyes were teary and face flushed. Ray should help by offering him a drink, giving him 5 back blows between shoulder blades, calling 911 urgently and getting ready for CPR, encouraging him to cough while monitoring his airway, breathing, and circulation. What option is correct as we go to next question 14? A team consists of 2 or more rescuers. Which of these will help the team to function optimally during a resuscitation attempt? A, roles and responsibilities must be clearly established. B, positive or constructive feedback is important. C, knowing everyone's limitation or boundary is necessary. D, all the above. Question 15. Which role should be switched every 120 seconds when working as a team? Which role should be switched every 120 seconds when working as a team? A, the AED operation. B, the ventilation operation with a bag valve mask. C, the chest compression role. D, the documentation. What choice is correct as we go to the last question? Question 16. You are a part of a two-person team performing CPR on a 30-year-old undergraduate student. It is evident to you that the rate of your colleague's compression is about 80 to 95 per minute. What should you do? You are a part of a two-person team performing CPR on a 30-year-old undergraduate student. It is evident to you that the rate of your colleague's compression is about 80 to 95 per minute. What should you do? A, tell him that you notice a decreased compression rate. B, take over from him immediately because he is tired. C, allow him to continue until it is your turn. D, or the above. Make your selection as we are about to see the answer keys. these are the correct options. So number 1 is C, number 2 B, number 3 B, number 4 is C, number 5 D, 6 is E, 7 is B, 8 is E, 9 C, 10 B, 11 B, 12 B, 13 D, 14 D, 15 C, 16 is A. So if you didn't get any of them, please scroll back and see the right one, and that way you are going to know it. Alright, so thank you so much. Thank you for watching, and please remember to like this video, comment. Your comment is valuable and will be appreciated. Share it widely, and if you have not subscribed, please do that. And also remember to turn on your notification bell so that when I upload more videos in future, you get alert. And feel free to contact us, and the email to use is theteacherchannel@gmail.com. Okay, you want to make a suggestion, you have a question to ask, or maybe you are you want to make inquiry about training, BLS training or first aid training, please send us a request. Thank you again, and I will see you next time. Bye.